Hello, my name is Donna Delasa and I'm a clinical psychologist, and with my colleague Shannon Malloy we have the privilege of providing a psychology service for patients involved in the Our Hearts, Our Minds team. Now I realise I'm speaking to an audience who've had a wide range of cardiac events and diagnoses and a range of treatments and procedures, but whatever your experience has been, I hope that you can gain something beneficial from this talk to help you in your recovery. Having a heart attack or a heart condition can be a life-changing experience with very obvious physical consequences. However, research has indicated that psychological factors such as anxiety, depression, and poor acceptance of the condition can have as significant an impact on recovery as medical factors. So it's important that we address these psychological factors to help patients to have the best possible outcome in their recovery. A survey by the British Heart Foundation of patients with a cardiac diagnosis found that over 2/3 of respondents reported that their heart condition had affected them emotionally, mentally, or psychologically. So that means that the majority of people will have a psychological response to their cardiac experience. And within this particular survey, 77% of patients said they felt anxious, while 51% reported feeling low, depressed or tearful. And other issues identified were feeling scared, isolated, and feeling that no one else understood what they had gone through. So why don't we just pause for a moment, and why don't you just take a moment to reflect on some of the feelings that you've been having since your cardiac event or your diagnosis. It's important for me to stress that your emotional reaction has been perfectly normal. It's what makes us human. You may have heard the saying, "It's okay to not be okay," used a lot over the past number of weeks as we're responding to major change in our normality. And it's okay to acknowledge that your thoughts and feelings have been impacted by your experience. And this is because the effects of a heart condition can be far-reaching. Perhaps you've had a heart attack and this was a near-death experience and now you're having thoughts of your own mortality. Or maybe since your diagnosis you feel more vulnerable and not able to do the things that you did before without worry that something dreadful will happen. Perhaps you live with continual uncertainty and fear of what the future will bring. And perhaps you're having difficulties with sleep and this is having an impact on your day-to-day functioning. Maybe you feel that others don't fully understand what you've gone through, and this can have a strain on your relationships and lead to feelings of isolation. Many will have experienced change or loss. Perhaps your role has changed following your diagnosis or event. This might involve having to take some time off work or even having to leave your previous job altogether. And this may cause strain on your finances or on your relationships. And a sense of uncertainty for the future can cause an increase in stress and anxiety. Perhaps other roles in your life have changed too, such as involvement in sports or recreation or in voluntary service. Or perhaps your roles in your family or social circle has changed now. A change in role can have an impact on our sense of self and identity, causing us to feel unsure where we fit in. And therefore the effects of role change can be far-reaching and can lead to symptoms of depression. And so while some changes occur without our choosing, when you have a cardiac event or diagnosis, there are many changes that you will need to make proactively in order to minimise your risk of another event. An example of this is medication. How did you feel when the nurse first presented you with a list of medication to take? Perhaps you haven't taken medication before and now you worry about the new routine and the possible side effects of all these tablets. Perhaps you're a heavy smoker and now you're trying your best to give up. That is a tough but a very necessary call. You likely have been introduced to the Mediterranean diet now by our dietitians. Was this something you'd even heard of before? How was your score? Was it a good result? Or was there definite room for improvement? And now the physiotherapists and exercise specialists are talking about increasing your physical activity. This may be no problem for you at all, or perhaps this is entirely new, quite a scary concept. Phew, it can be difficult to implement even one change, never mind several at the one time. And as a team, we understand that. That's why we want to support you in any way that we can to help you feel capable and motivated to make the changes. You don't have to feel alone in making these changes. And as we just take a second to reflect again, what has been the most significant change for you? And is there someone that you can ask to help support you through this? So while there are many challenges, I want to reassure you that for most people there will be a process of adjustment. Initially, things will feel difficult and unfamiliar, and you may experience feelings of shock or denial. You didn't really have a heart attack, did I? The process may have seemed quick to you. Perhaps you had to go into hospital in an ambulance, and before you knew it, you were having stents put in, you were back on the ward and home again, and you wonder if it really happened, or was it as serious as the medical staff were telling you? And perhaps then, as it sinks in, you may feel some anger. Why me? Particularly if you feel that you've been looking after your heart health. Then you may move on to a stage where you feel somewhat preoccupied with your health. For example, you may become more aware of chest sensations and assume that there's something wrong. And we will talk about these thinking patterns in a moment. But over time and with the right support, you will gradually become more accepting of your condition and learn to cope with it. And as you do, you will begin to make strides towards making the best recovery that you can. Many patients that I have seen have remarked on seeing things with a new perspective. They value life in a new way and want to get the most out of it, focusing on what matters to them. This might be relationships or hobbies or charity events, and all of these things can make life seem more positive and worthwhile. So with time and support, there is hope for a bright future. But while you are in that process, an important psychological factor to consider is how our thoughts and feelings about your experiences can have an impact on your behaviour or what you do. Because what we do can either help or hinder our recovery from a heart condition. You might have noticed that your thoughts have changed since your cardiac event or your diagnosis. For example, for those who have had significant cardiac symptoms such as a heart attack, prior to the event, when you experienced some chest discomfort, what thoughts did you have about what was going on? Did you immediately assume it was a heart attack? Or did you think it was something else like indigestion, or perhaps that you had overexerted yourself in some way? Your thoughts will then have an impact on your feelings and your behaviour. So if you thought that you had indigestion, you may feel mildly irritated at the discomfort, but generally unconcerned. And if you had some at home, you may have taken some indigestion relief or sat down and had a rest. However, after your cardiac event, if you had discomfort in your chest again, would you still assume that you had indigestion? You might not this time. You might assume that you're experiencing another heart attack or a cardiac event. This will lead to a different response and feelings from the previous example, feelings both in your body and in your emotions. You might feel fearful or anxious. And this might be because your body is reacting in a completely different way to what it did before you knew you had a heart condition. This time, there's a type of alarm system that recalls what happened the last time and is going to ensure that you're ready for a state of emergency. It's called the fight or flight response and is initiated by a part of your brain, and it's preparing you to fight the danger or to take flight, that is, run away from it. And you will notice your body responding to this alarm system. You'll likely feel your heart beating faster. This ensures that blood flows more quickly around the body. Blood will also flow away from parts of the body that are thought to be non-essential to the fight or flight process, such as the digestive system, and you may feel changes in your stomach or your bowels. It also flows away from your head, so you may feel lightheaded or find it difficult to think clearly. It also flows away from the periphery areas of your body, so you may experience tingling in your fingers and toes and feel hot and clammy as your body tries to get rid of excess heat. And some of these symptoms can mimic the symptoms of a heart attack, which may add fuel to your anxious thoughts that you are having a cardiac event. And this will have an impact on what you do, and may lead you to call an ambulance or attend an accident and emergency. Or it may stop you from doing an activity, believing that it's dangerous, and this will have an impact on your recovery. So how can you manage anxious thoughts? I think an important factor to acknowledge is that it is normal to have anxious thoughts after your experience. And we can actually feel more distressed when we think we shouldn't be having them. Anxious feelings don't last forever. They will rise, they will peak in intensity, and then they'll reduce again. What I would suggest is learning strategies to help your body and mind relax. And in our next video, Shannon will present some relaxation and mindfulness techniques that you can use to get your body out of fight or flight mode and into a state of rest and digest, where your heart rate and blood flow return to normal, enabling you to think clearly about what you are actually experiencing. If it is an anxious response and you are able to calm down, then your symptoms are likely to disappear. And these exercises will also help you with your sleep difficulties. However, it's very important that I should note with you that if pain or discomfort continues in your chest area, then it is time to get some medical advice. Finally, I'd like to give you a simple strategy that can proactively help you to manage your emotional well-being. And it's encapsulated in one word or 3 letters. And that word is ACE, or A-C-E. You can see it here in a pie chart, and it represents balance between the 3. A is for achievement. This is about completing tasks that you've set out to do, or setting yourself small goals and achieving them. This might be related to adopting healthy behaviours or completing small home or gardening projects. Achieving something helps us get a sense of self-efficacy, and this can positively affect how we feel about ourselves and give us good self-esteem, and this can positively affect our mood. C is for connection, and it's at 3 different levels. Firstly, it's about connecting with ourselves, and this is about stepping out of autopilot and truly getting to know what's going on internally for us. Identifying what our thoughts and feelings are and becoming aware of what our needs are. Paying attention to what is going on for us helps us to identify and meet our physical, social and emotional needs. Connection to significant others has never been more important. We are made for community and connection, and isolation will lead to loneliness, low mood and depression. So think about who your significant others are and who you need to connect with on a regular basis. Connecting to the environment is important to allow us to feel in the present moment, so that we're not continually engaging with anxious or negative thinking patterns. You can do this through being more mindful as you sit in your garden or go for a walk. Use your 5 senses to engage with where you're at. And Shannon will discuss this in more detail in our next video, so please tune into that. E is for enjoyment, and this is about deliberately and intentionally choosing to do something that you enjoy, whether it's about re-engaging in a previous hobby or about picking up a new one. Sometimes we can feel guilty about doing something for the sake of enjoyment, particularly if we have always been doers and we like a to-do list or a task list. But when it's in balance with achievement and connection, experiencing enjoyment will be protective for our mental health. And as I finish, if particular issues have resonated with you during this talk, please do not suffer alone. Support is available from our service, so please get in touch. As I said, psychological factors can impact on your recovery as much as medical factors can, so it is important that you get the support that you need. At this point, I'd like to thank you for your attention, and I wish you well in your recovery.